Good morning, YouTube. Tristan here. This morning I had an idea for a video, something that's pretty common in the outdoor world, something that we've all heard of happening. This is a issue that I've had a few times in my career of having to go out and get these patients, and that is a cardiac emergency in the field. Something that I wanted to address is recognizing that it is an emergency, recognizing that this isn't just the same old acid reflux or same old pain you get after eating that breakfast burrito on your way to the stand or on your way to your property, that this is something completely new and completely different. And most of the time when we go out to these patients having a cardiac emergency, a heart attack, they're going to complain of chest pain of some sort. Patients complain of a tightness in their chest. Some complain of a sharp sensation in their chest, a heaviness. And these are all the same things that we need to be looking out for. We need to watch out for the chest discomfort, any arm numbness or tingling, nausea, vomiting, and any diaphoresis. So any sweating in a cold environment, anytime that you can wipe your head and the sweat beads right back up immediately, recognize that that's not normal, that's something pretty serious that's going on. Recognizing this emergency is just the first step. The second thing that I believe is most important is putting together a plan. What am I going to do now? In my mind, the first thing that you should do is activate the 911 system. If you can, call 911, notify emergency dispatch of your situation. If you're able to, notify them of the location, whether that's sending them a pin, sending them coordinates. A good idea also is always a good practice is to notify your family or your friends of where you're going to be for the day. That way, if you don't turn in when you are supposed to, they know where to come find you or come look for you. The next step that I would say is probably the third most important thing after activating the 911 system is if you are in an elevated platform, if you're in a saddle or a tree stand, is making sure that we quickly get down to ground level. We don't want any fainting episodes or syncopal episodes occurring while in an elevated situation. There's obvious harm for secondary injury being in that elevated area. So get down to ground level. Once you're down at ground level, I think the next thing we think about is whether we are staying put or we're going to try to make it out to our vehicle. Most likely emergency dispatch has communicated this with you, and most of the time they do recommend you stay where you are, so that there is no confusion on your area, there is no mix up on what your plan was, and first responders and pre-hospital care can get to you in an efficient manner. Once you decide to stay, there are a few things that I think we can do to make our location, make our extrication most efficient. And one of those things is if I have a flashlight, whether that's a headlamp or a hand light, I'm most likely going to turn that on. If I have multiple flashlights, I'm going to turn that on. If I have a headlamp, I'm going to put it on my head, turn it on, and I'm going to probably prop myself against a tree. If I have a hand light, I'm going to set it in a position to where it is not shining into the dirt. I want it shining in an elevated position into the trees. That way, if first responders come in and I'm unconscious, they may be able to see that light. Obviously, if you think you're going to be in this situation or this area for a long period of time, you need to preserve your batteries if you can. But if it's going to be within an hour that you're expecting responders to get to you, I would most definitely keep my light on. In an event that is cardiac in origin, there are a few things that we can talk about. We can prepare now with that we were able to take with us that will be a help. And the first thing is aspirin, ASA. Aspirin is going to be a big deal if you are actually having a heart attack. That is going to be a way that you are going to hopefully keep that heart attack from getting any worse while waiting for responders. Aspirin is a platelet aggregator, and what it does is it slickens the platelets. It keeps you from clotting any worse around that clotted area in your coronary arteries that are feeding your heart. Because what happens in the heart attack is we have our arteries that are feeding our heart, that are keeping our heart tissue alive. We now have a clot inside that artery. Our blood naturally wants to clot around the occlusion site, and aspirin will allow that blood to hopefully slip past and not worsen. The next thing is if you have a cardiac history and you are already prescribed nitroglycerin, this is where I would take a nitroglycerin, but you've got to be super cautious here. There are types of heart attacks that can cause you to have a low blood pressure, and what nitroglycerin does is it increases your, if we think about plumbing, it's a pretty easy comparison. If you have 2-inch pipe and this is your coronary artery in your heart, nitroglycerin takes that 2-inch pipe, blows it out to 4-inch pipe. So if you have a clot that's in there causing that heart attack, and you take that nitroglycerin, it is going to increase the diameter of your container and allow blood to get around that clotted area. So aspirin and nitro both can work together and be super beneficial. You still have to be very cautious with the nitroglycerin because we are increasing the size of our container and we are not increasing the size of our volume within. We have a significant drop in blood pressure. One nitroglycerin most of the time is going to be okay, but I would be super cautious in taking multiple nitroglycerin tablets before pre-hospital care makes contact with you. In my line of work, what I prefer to do is to have a blood pressure well before even administering one nitroglycerin to make sure that we have a safe range for that blood pressure to drop. If your blood pressure drops in the field, there's a strong possibility that you'll have a syncopal episode or a fainting episode, which again can lead to a secondary injury or lead to you being unable to make contact with responders that are coming in that are maybe yelling, trying to make verbal contact with you. If you're unconscious, you're definitely not helping the situation. So yeah, position yourself in a manner that is easiest for extrication against the tree, in an area in the trail, in an area that's most easily seen, most easily accessible, and wait for responders to get to you. I hope this has been a help. This is something that occurs pretty frequent during deer season. Stay safe. If you want to hear more instructional videos, more educational videos on wilderness medicine and outdoor emergencies, tune in, subscribe to our channel, and please like our videos.